All right, so we're going to go ahead and get started, and hopefully others who have also registered for the event will be able to join us. So I want to extend a very warm welcome, everyone, to today's event, which is fundamentally about the power of voice, and specifically the power of more than 1 million women and girls' voices demanding for change in their own health and their lives as part of the What Women Want campaign. Today, White Ribbon Alliance is thrilled, really thrilled to be launching our What Women Want dashboard, which is an interactive tool that allows anyone, anywhere, to hear directly from women and girls who participated in the campaign. And we're also just really excited to have a conversation with all of you to hear more about how What Women Want can advance gender equality priorities in your countries and in your contexts. My name is Kim Whipke, and I am an advocacy and communications manager with White Ribbon Alliance Global. It's my privilege today to open and close the event and to share a bit more about the What Women Want campaign from a more global perspective. For those of you who may not know about White Ribbon Alliance, we are a global network whose mission is to propel a people-led movement for reproductive, maternal, and newborn health and rights. And finally, before we get started, I do want to acknowledge that this event is being recorded so that by virtue of your participation in the meeting, each participant is giving their consent to be recorded. Next slide. Just to keep things moving, recognizing that we have several individuals in the meeting today, we ask that you do introductions in the chat box. So please just take a moment and quickly write in the chat box your name, your affiliation, if you have one, your country, and your email address if you're comfortable sharing that information. And you can just do this as I talk through the next several slides. Next slide. I also just want to briefly review some expectations for this virtual meeting. The first is to keep yourself muted unless you're speaking. There will be some dedicated time in the agenda later on for small breakouts where you will have a chance to come off mute and share your thoughts and perspectives directly. Turning on video is completely optional. It would be wonderful to see faces, but we do also understand that your circumstances may make it less likely for you to be able to actually put that video on. We ask that you put your questions for presenters into the chat box for the dedicated question and answer sessions. And that also includes putting your questions into chat while presenters are even speaking so that we can queue those up ahead of time. During breakout discussions, we do ask that you limit your individual comments to 1 to 2 minutes to give participants, as many participants as possible, the opportunity to share. And then finally, we just ask that you uphold the NGO CSW65 virtual safety guidelines so that we're all promoting an inclusive, respectful environment as we talk through these issues today. Next slide, please. So this is our event agenda in brief. It's really broken down into about 3 main components. First, we'll hear a bit more about the What Women Want campaign, both global overview and then specific mobilizer reflections from India, Pakistan, and Kenya. After hearing from the speakers, we'll have a short question and answer session. We'll then segue into a presentation and a live demonstration of the What Women Want interactive dashboard. We'll pause again for more questions and answers, and then we'll transition into small breakout group discussions, and then we will come back in full plenary to adjourn. Next slide. Thank you. This is perfect. So I'd now like to just spend a few minutes describing and telling you more about the global What Women Want campaign. So White Ribbon Alliance launched the campaign in April 2018. And it was based off an earlier campaign that was really designed and incubated in India. And my colleague Smita will share much more about that with you in just a moment. I do want to underscore that at its core, What Women Want is an advocacy campaign. It's a voice campaign. And it began with a simple but radical idea. ask those who most use reproductive and maternal health services what they most need. In the end, what women want heard from nearly 1.2 million women and girls from across 114 countries, though the majority of responses came from 8 countries in particular. And this was made possible just by the tireless dedication and passion of a legion of community mobilizers. These included tens of hundreds of groups of community members, journalists, health providers, activists, who really volunteered as those mobilizers, as those translators. They took guidance, they took templates, they took consent forms, and really just ran with it. And while the collection of responses looked a little bit different in every country and context, what held and what was consistent across this mobilization effort was the question itself. Next slide, please. And that question was, what is your top request, your one request for quality reproductive and maternal health care services? And here you'll see some of the top answers that came out globally: respectful and dignified care, water, sanitation, and hygiene, medicines and supplies, midwives and nurses, and much improved health facilities. And for those wondering how we arrived at these results, Diana and Angel will actually say a bit more about the coding and categorization process later in their remarks. That said, what these answers, just go back, please, thank you. That said, what these answers really reveal and say is that women truly want and are demanding basic infrastructure and basic decency. This is something that they want above and beyond any individual health service or solution. And it's quite clear that as a global community, we're simply just not meeting women and girls where they are at this moment. The other thing I think that's important to note is that although the question that was asked was framed specifically around what you want for your reproductive and maternal health, women and girls' answers took us far beyond that. You know, a lot of what women and girls said, their top answers, the issues that they're facing, actually really do speak to gender inequalities, and they speak to social determinants of poor health in particular. And then finally, I just want to mention that grassroots voices of women and girls are really catalyzing concrete change at the country level in particular, from upgrading facilities to improving policies. And you'll hear a few of these examples as we hear more from my fellow presenters today. I do want to give one more reminder for those who just joined the meeting a bit late to just kindly introduce yourself in the chat box by sharing your name, your affiliation, your country, and your email address if you feel comfortable doing so. Next slide, please. So now I'd like to introduce our fantastic moderator for today's event. Professor Pascal Alati is the director of the United Nations International Institute for Global Health, a position that she's held since 2017. She's a nurse, a midwife, and a public health nurse with postgraduate training in public health anthropology and epidemiology. Her research in global health covers health equity, health and human rights, gender and social determinants of health, migration, sexual and reproductive health and rights, tropical diseases, and non-communicable diseases. And she's published extensively on these topics. Last thing, I think this is a wonderful point. She's pioneered methodological approaches for engaging communities in research and policy processes to ensure that joint ownership and partnership in health and service delivery, which is really a great match for today's event. So welcome, Pascal. I'm going to turn it over to you now.
Great. Thank you very much, Kim. Good evening, everyone, from Kuala Lumpur, where it is 8:15 in the evening and a balmy 26 degrees. Lovely to have you join us this evening. And just before, you're not here to listen to me, there's lots of fantastic presenters going to join the conversation this evening. Just a few introductory remarks, though, before I start. So The United Nations University International Institute for Global Health is one of 14 institutes within the United Nations University system. We focus on global health, and we perform a think tank and policy analysis function, which means that we work a lot with data. What I find particularly exciting about the White Ribbon Alliance is that it provides an opportunity for us to extend what that means. Within the context of global health, we tend to focus very much on, or generally focus very much on hard data, particular paradigms of viewing what research means and what data needs to be privileged. And with a real commitment to gender equality, we have to change the ways in which we think about what information and what constitutes data and what constitutes evidence if we really want to make a difference to women's lives. So this is incredibly exciting that this work is being done. My institute, UNU IIGH, is actually launching tomorrow a Gender and Health Hub. So if you're available tomorrow, please join that as well. It's slightly different in its focus, but also does include crowdsourced information. A final comment is that in rethinking the sorts of information that we need to privilege for the work in order to make a difference to women's lives, we have to think about different ways in which that information is being collected as well. Within global health, again, there's a lot of debate about decolonization, about pathways to doing that, and so on. But again, it's very much people of privilege feeling like they have the answers and providing them for others to take on. The authenticity of this work with White Women Alliance is that it is an opportunity to amplify women's voices in their entirety, in their authenticity, without pretending to represent anyone. It's a platform where women have spoken themselves. It's very exciting, and it's a real opportunity now to listen to how the information was compiled and brought together and how you can access that information directly. And I would really, really like to see an extension of this project across a whole range of other really important areas for women. So shutting up now, I'd like to open up the first panel of speakers where we're going to hear from the experiences of people who have actually been involved in bringing this information together. The first person that I will introduce is Smita Bajpai. Smita is a doctor of Ayurvedic medicine and surgery and is an executive committee member of the White Ribbon Alliance in India and leads the White Ribbon Alliance in Rajasthan. She's currently project director at Chetna, a local organization that initiated and has anchored WRA Rajasthan since 2002. Smita has more than 30 years of experience in the women's health and development field and has led several advocacy initiatives for maternal health at the local, state, national, South Asia, and global levels. We will not have time in between to stop and ask for questions of clarification. If you have questions, please engage with us in this conversation through the chat function. Keep the questions coming and we will have a discussion afterwards. Dr. Smita, over to you.
Thank you, Pascal, and welcome to this very exciting presentation. Hello, everyone, and namaste from India. Today, I will be talking about What Women Want campaign, which sparked a global revolution for social change. The What Women Want campaign facilitated participation and decision-making of women in public life. And when I went through and registered to the CSW65, it seems this is a priority theme for the CSW65. So this campaign, besides other global initiatives, has contributed to the theme of CSW65. And I will be talking, at times I'll be talking about a village in India, at times of the state, at times of India, and at times global. So pardon me if I forget to say whether it's national or local. And if there is any question, please note it down. Next slide, please. Next slide. We all know that the 17 sustainable goals laid the foundation of a sustainable world by 2030. Goal 3, good health and well-being, and Goal 5, focus on gender equality. More than 5 years down the lane, when we see around us, we see ill health and gender inequality, which says that much needs to be done. We also realize that Goal 3 and 5 both are interrelated. When we talk about, particularly when we talk about health of women and girls, their health and well-being is linked to their social status. And when we talk about gender equality, we need to talk about health and well-being of women and girls. So both the goals are interdependent, and we need to talk about both the goals at the same go. And the What Women Want campaign focused on both these goals, which is a very innovative thing in their own right. Next, please. The story began in India. When we saw data which indicated that there has been a significant increase in access to health services, and the focus was shifting to quality of health services. White Ribbon Alliance India initiated a campaign called Hamara Swasth Hamari Awaaz, which means our health, our voice. We asked women one question, which was, what is your one ask regarding quality maternal health services? We had 114 partners, and more than 1.4 million women responded to what we asked. They spoke in local languages. We talked to diverse women in diverse settings. That there were translations, computerization, coding, and based on what women said, top 5 demands were identified. Among these, access to maternal health entitlements, dignity and respect, availability of health providers, clean and hygienic health facilities, including toilets, and display of information were the top 5 demands which women wanted. The demands formed the basis of action agenda, which was presented to the topmost decision-making body, the Health Minister of Government of India, by women themselves. So what we realized that What Women Want campaign was instrumental in contributing to improving quality of maternal health services and facilitating a social change where women were accessing spaces which were otherwise not available to them. Next, please. I would just give an example of how this helped in setting up decisions that were affecting women. This was an incident which I witnessed in a local village assembly in Rajasthan, where the leader, who is called the Sarpanch, had planned for electrification of villages. He was promising lights to every household and street lights. But when in this assembly, we talked to women, women demanded water. Due to a technical problem, certain households were not getting tap water in their homes, and women and girls had to fetch water quite several times in a day. So their need was water, and the planning was electricity. In this, through a process of negotiation, women demanded, they said, we don't want lights, but we want water. And at the end, the leader agreed. So this is an example of how women facilitate a need-based planning, a planning that is realistic, a decision that affects their own lives in their own context. Next, please. From India, The Hamara Swasth, Hamari Awaaz campaign formed the basis of the Global What Women Want campaign, which was anchored by White Ribbon Alliance Global. And Kim has shared about the demands that came out and the reach that the global campaign had. And interestingly, this campaign listened to a lot of women and their demands. And after listening, these demands were also processed to affect policy change. I will not talk much about that because Kim has already said about the campaign. Next, please. I would like to tell stories which make this more interesting. So we had this one question. What is your one request for quality reproductive and maternal health services? This was an open-ended question, and it helped women lead the process. And when we asked them across the globe, the responses were unexpected, challenging assumptions, and also helping us to learn more about their lives. In India, when we talk to women, there was surprise at both ends. Women were surprised because nobody has asked them, what is your demand? And we were surprised that how can anybody not ask them? So in this process of surprise, there was complete silence because women did not know what to respond. Then followed some giggles, some shoo-shooing in between amongst them. And when we spent time, we talked to them, spent time, then they came out with stories. We wanted one demand and they came out with stories. Long stories of harassment, of struggles, of cost of care, of disrespect. And some also shared good examples, good stories of good experiences. After that, we tried to narrow down, help them articulate to one demand. Even that was more challenging because for them, health is comprehensive. It is not in compartments. So their wants would be, we need water, health, food, doctor, services, transport, supplies, everything. So it was a challenge to listen to them, listen to their voices. At the same time, we felt that we need to provide them a forum where they can ventilate. Then the process of translation, coding, and analyzing began. Next, please. After hearing from women and getting their demands, we, along with women, planned the strategy of how do we take demands to whom. And there were a range of people whom women wanted to reach out to, including administrators, health officials, elected representatives, media, from local to national. So there was a range where women wanted to go. For women, access to local decision makers was easier. But as we moved up, the block, state, district, national, international, it was a steep climb for many women. They could not reach here. So we strategized and asked them to nominate their representatives, and that their representatives came to different forums and also shared what women wanted. When we look at women's empowerment, control over their mobility is one of the shackles women face. And it's very difficult, very, very difficult for a lot of women to come out of their homes and participate in public domain. And this is where we need solidarity, we need organization to bring women and remove those shackles and ensure women's participation in public spheres. Next, please. Planning for those decision makers. Now women came forward to take these demands to decision makers. And in Rajasthan, women held processions. If you can see the bottom picture, they held their charter of demands and they took a procession. In numbers they came and they participated in dialogues organized by WRA team members. They were interactive, where women came and presented their demands both verbally and written. We helped them write. For women who turned out in numbers, number is power. It's smart because it helps women to strategize, to gain solidarity, confidence, and also prevents backlash. So women came, and for several, it was for the first time participating in a public forum, holding a mic and speaking in a mic. Next, please. Gracefully and confidently, women once were presented to the Gram Sabha, the village assembly, to the MLAs, to the state level officials, where women came and spoke about what they want, and they also sought commitments from the decision makers. One of the key strategies for women's empowerment is opening up spaces. Given the gender power relationships and the patriarchal structure, there are several places which are not open to women, and that needs to be opened up. What Women Want campaign opened up those spaces. It also focused on changing the unequal gender power relationships, and where women power platform. Next, please. Media is one of the key influencers. And when we initially talked to media and asked them to publish news focusing on what women want, there was hesitant because they were often used to getting data and evidence from dignitaries. Gradually, after much dialogues and negotiations, they agreed and started publishing and elevating women's wants. Next, please. Next, please. All these wants led into some action. And when we look at what happened after the wants were presented, we were happy to see that at many places changes have taken place. Since its launch in 2018, What Women Want campaign has more than 20 policy changes across the globe. And these include changes related to respectful and quality services and care, WASH-related issues, sexual, reproductive, maternal health services, and supplies. So there has been a lot of changes happening. And when I talk about India, respect and dignity was one of the topmost 5 priorities. And the What Women Want campaign facilitated and contributed to inclusion of respectful maternity care in the Laksh initiative of the Government of India. The Lakshya initiative focuses on labor room reforms, where respectful maternity care is one of the objectives of the initiative. The White Ribbon Alliance India also piloted respectful maternity care in high load facilities in 5 states of India to set an example and demonstrate. And currently, with the help of Global White Ribbon Alliance, we are piloting respectful maternity care during pregnancy and after childbirth by frontline workers. So a lot of changes have happened in lives of women through What Women Want campaign. Next, please. Next, please. Despite that, I feel, and miles to go before I sleep, What Women Want campaign is a beginning. It has led to some changes, substantial changes, but a lot more needs to be done. When you are listening to what women wanted and how it has taken place across the globe, one needs to think that how you, when you go back, would take this approach into your own countries, into your own organizations, empower women, and help achieve the targets of goal 3, and which is health and well-being, and goal 5, which is gender equality. Thank you so much.
Thank you very much, Dr. Smita, for that. I particularly want to highlight from your presentation that while the entry points that this discussion has started with may be maternal health, sexual and reproductive health, what you demonstrated was the fact that once you open up the spaces to allow women's voices to be amplified, it can be scalable to a whole range of political processes, local government and local decision making, the use of media and so on. I think that is a fantastic start. The next session that we're going to, the next presentation that we're going to have is about moving beyond silos. And the two presenters, we're going to have a twin presentation. Is that right, Kim?
So Talha's going to go, yeah, and then Nice will go after.
Okay, so we'll have a double session here with Talha Rashid, who is a driven, ambitious, and quick-witted young woman who currently serves as a professional public speaker and content writer, and you will see why as soon as you hear her, for Fire Communications and Agency 21 International in Pakistan. Her experience as an advocate in WRA's What Women Want campaign, along with the lack of basic health facilities in her hometown Shimsal, motivated her to do a master's final year project on pregnancy risks prediction using classification algorithms, a comparative approach, which garnered appreciation from her department. Talha holds a master's in health informatics and is aiming to pursue a PhD in health and artificial intelligence. Talha, the mic is yours.
Thank you very much, Doctor. I would like to apologize that I have to switch off my camera just because of the bad internet connection over here, as I'm in quarantine situation right now. So I'm going to start about my journey that I have been part of What Women Want campaign. In my journey of reaching out to women to know their key asks regarding reproductive health, I encountered some diverse and startling views. I would like to mention that I found some women were skeptical of the What Women Want campaign, whereas others saw it as a way to use their voice and claim their rights. But it would be interesting that what really struck me was how women's and girls' answers went far beyond reproductive and maternal health services. Like many women I spoke with first implied that such campaigns are useless. They usually don't create change and they are just a waste of time. According to them, nothing would happen to change the status quo, which means like the unhealthy environment we have, the disrespectful behavior of staff with patients in the hospitals, non-availability of free beds in the hospital, lack of beds in hospitals, leading to women giving birth even in the corridors. And none of this will be changed by the government as it hasn't been changed. So why bother raising voices? It really took me a while to convince them that if we women will not raise our voices for our rights, then nothing will ever change. Through dialogue and discussion, I was able to bring home the fact that this struggle for quality reproductive health is not just for us, but I must say rather it is for the betterment of all our future generations. And I noticed that educating these women about the significance of stepping forward to ask for their basic universal rights can actually make a difference. And it really made all the difference throughout this campaign. Let me share here one of my experiences in an underdeveloped region of the province Khyber Pakhtunkhwa. Frankly speaking, it was not easy to record the demands as there was a kind of fear among the local women, as if they were doing something wrong, as if they were committing some crime. And you would be amazed that the crime was to talk about their reproductive health. Unfortunately, they had been raised and they are being raised in such a manner that raising their voice for safe, respectable, and dignified healthcare services seemed to be a kind of sin to them. I must say over here that this campaign created an awareness among women and made them realize that it is their right to have safe and respectful healthcare. In fact, many times during the campaign, it appeared to me as if a kind of energy had been given to these women, or a kind of stick of Harry Potter, a magical stick has been given to them by simply letting them know that they deserve a lot more. In fact, so for the women who did participate in the What Women Want campaign, let me paint a picture as to why they did not simply ask for this or the reproductive or maternal health service. First and foremost, I would like to mention that there are places in some underdeveloped areas where if a woman somehow has the courage or developed a courage and decides that she has to go for a checkup, then a major issue which she faces and encounter is that of the accessibility. Because in these areas, the health centers are quite far and are located at a distance. And it is difficult to reach there because of the absence of required infrastructure. Either there are no proper metal roads available in the first place, or even if they have not been maintained by authorities and they are in very poor condition. On top of that, I would like to mention that the transport that generally available over there is either a donkey cart or a horse cart. And in a very few situations, if you are lucky, then maybe the back of a van. Well, the story doesn't end over here. It's because if a woman somehow manages to reach a health center, then again, she has to face several other hurdles. Like, first, she has to deal with the staff at the reception desk, who quite often misbehaves in a rude and careless manner. Then is the hours long wait for the doctor. And here I would like to mention only those that are privileged get the chance to jump the queue. Privileged means over here that those who belong to a higher socio-economic group, or those who are personally known to the doctor or other working staff over there. And then once the women finally gets to meet the doctor, the situation is that she's hardly given a couple of minutes, and even during that time, the doctor is listening to her only half-heartedly and superficially, rather, I would say, with less attention. Then I would like to highlight that in certain situations, if the doctor prescribes a visit to the radiologist, then the woman has to face the very high probability of being inappropriately touched and handled by the male staff of that respective radiology department, since there is hardly ever any female staff in this department. And yeah, in my experience, whenever I've been to hospital, I literally haven't seen any female staff in this radiology department who are supposed to do the x-rays of us. So there is no small wonder that thousands of women were asking for basic things like good roads and good medical staff. Now, the point is, what do we do? How do we change the system? To me, I think it all starts with educating those giving care as well as those receiving care. They both are very, very important to educate. Those receiving care, that is the women, we need to be informed about our rights and the importance of raising our voices for right. Similarly, at the same point, there's a need to give care, and there's a need to sensitize and educate the people who are giving care to these people. And I would say it must be in the provision of safe, respectable, and dignified healthcare services. I would like to mention that we at White Ribbon Alliance Pakistan have already taken the first step in this direction. And I think since mid last year, we have been working closely with the government's health regulatory bodies like the healthcare commissions in the provinces of Khyber Pakhtunkhwa and the province of Punjab. And we have been able to get the guidelines for respectful maternity care incorporated in the minimum service delivery standards for midwifery services. This essentially means that all healthcare staff at the maternity homes maternal and child health centers, midwifery clinics of lady doctors, and even in family welfare centers throughout these two provinces will be legally mandated to observe the protocols of respectful maternity care when interacting with female patients. And it's really very important. I know it's a baby step and it's our first step. And inshallah, in the coming years, we will be taking this initiative to other provinces as well. Lastly, I would like to mention that I think all this is happening simply because women in Pakistan, we know that we are strong enough to believe that our voices have the power to change our world, and that too for the better. Well, that's all from my side. I hope I would be able to reflect my journey as efficiently as possible that I have tried.
Great, thank you very much, Talha. Some very insightful reflections, noting, of course, a whole range of intersectional issues there, including lack of representation of women amongst some of the key health services that are required. I'd like to invite now the next speaker, young lady, also to give us her reflections. Nayase Tampes, I hope I pronounced that right, is a 20-year-old Maasai woman from Narok, Kenya, who is passionate about social positive change, especially on women, young people, and children. She's currently a student at the African Leadership University in Rwanda, pursuing a bachelor's degree in global challenges and will major in governance and policy. Nayase is a trained advocate in sexual and reproductive health and rights by White Ribbon Alliance, Kenya, and helped mobilize dozens of What Women Want surveys in her local community. She dreams of working with organizations and individuals who have their mission aligned to hers, and I'm sure her dreams will be a reality. Nayase, the mic is yours.
Thank you, Dr. Pascal. As you have heard, my name is Nayase Tampes. I'm from Kenya. I know she's introduced me with a lot of information. So today I'm going to talk about what women want and my experience in the campaign. And I'll kindly ask you to pardon me because I have to put off my video because my network is not stable. So kindly pardon me. I'm going to share with you my experience with the What Women Want campaign. In my community, women are an underprivileged lot of the community because it's a community that undermines women. The women in my community don't have a voice. They don't have even any space to speak out what they want. They don't have any privilege to make decisions concerning their life, including even who to marry, when to marry, the number of children they want to have when getting married, or for our girls, whether to attend school or not, whether to undergo FGM or not. So when I was involved in the What Women campaign, I was so much privileged because I know this was going to be a chance for me to interact with women in my community and actually hear their genuine responses about that. And among the responses that women want, I would just want to share with you their top requests and the ones that I feel they are most pressing for now. One was women asked for water. In my community, women have to trek for long to look for water, in which the water sources are not guaranteed. They do not guarantee water because they can even travel for miles and still don't get water. And the water they're traveling miles to go fetch is not actually clean because they share the water sources with animals, and you just know how animals are careless when taking water. They dip themselves into the water sources and dirty the water. And these women are fetching this water and they use it for all the household purposes, and that includes drinking. So the drinking the water that's not safe puts their lives into risk, because this brings them, it makes them prone to diseases like typhoid and cholera, and this poses a risk to their life. Women also complain that about the health facilities. They complain that the health facilities they have are far away and are not well equipped, and also they lack professional medics. And personally, I relate with this, and while I share this with a lot of emotions, because this is what actually is happening in my community. Let me just give you an example of my own home area health clinic. It is just a center that hardly has 3 rooms. It just has a reception where the doctor's office and the dressing room. And this is a center clinics that is shared by 8 villages. 8 villages sharing just a single health facility that is not well equipped, and it is only opened on market days. And market days in my place are only Tuesday and Friday. So in a week, the health facility is only opened in 2 days, and it is serving 8 villages. Okay, so women choose to deliver at home because they don't see the reliability of the hospital, and they need to visit it, because you never know when the baby kicks or when the baby comes. You don't know, you might go there and the clinic is closed. So they choose to deliver at home, and this has put a lot of risk onto their lives, because they develop complications, and they develop complications after giving birth in unsafe conditions. And even on their infant babies and other kids, they don't have an option to take them to hospital because it's fine, it's unavailable. So they will prefer to use the traditional medicine to treat their children, which is mostly not effective. But when the health conditions get serious, they will have to move to a different county. I just said county, or travel to the nearest town, which is miles away. And the roads are very poor. And on the transit from home to hospitals that are reliable and they're very bad, they're very far away, and the bad roads, many lives have been lost while trying to seek for better health facilities. And so therefore women asked, actually in my community, the topmost request was accessible and well-equipped health facilities. Moving on to our girls. Our adolescent girls are really suffering, and they asked us to provide sanitary towels. They shared the experience with us, and they shared to us that they actually, some of them extend sex for pads with men. You go, you ask, a man asks you what you want, and the girl says pads, and in an extent they have to sleep with them. And in our community, the sex education has not been embraced yet. So girls cannot have open talks about sex and their experiences with their parents, because it is termed as a taboo. They therefore said that schools were safer than homes because teachers played a more parental role. Their relationship with their teachers was more parental than the actual parents at home, because at school they have this freedom to talk anything with the teachers, because the teachers teach them on what they need to know, like the sex education. They need to know where to get their pads, and just that parentally chemistry between students and teachers. So they prefer that staying in school than at home. But when the COVID-19 pandemic struck, schools were closed in Kenya. They were totally closed, and students had to stay at home. And as me and some colleagues of mine and me, after seeing this challenge that our girls were facing, or they had to extend sex for pads, and also using some rags clothes, rags to use as pads. We had this initiative of trying to raise funds during using donations and also to provide them with sanitary pads. And as we distributed to them, you could see actually the need they had, that they actually needed the pads. That was like their basic need, because that was not readily available to them, and they had to do a lot of bad things to get it. The above requests from girls and women as a wind up, they only represent a small portion of what they are undergoing. And the What Women Want campaign actually brought their voices out to the world. This is what they really want, and they had a chance to explain to us. And I believe with the education that some of us like me were privileged to have, because in my community girls don't go to school, we're going to make a great impact by being their representatives upon the decision making tables. We are going to be their voice, and we shall let the decision makers know of these ones and push them to deliver to them. I think I'm going to end there. Thank you so much for your time. Please feel free to ask me any question. Thank you.
Thank you very much, Naisea. I think one of the really nice things, in addition to the actual data that you both presented from your work on the campaign, is the experience that you have had, and how much that will enrich you as well and empower you as individuals, as young women. There have been a few questions now, so I will look through the chat and draw some of the questions out. I think one of the interesting ones is that seems to be consistent, is about the multi-generational engagement. How can older women be a part of the effort? But I'll start off, so if all of you can comment on that a little bit, but I'll start off with some specific questions to individual presenters. So I have, for Dr. Smita, how did the government react to responses that were multi-sectoral? And in the What Women, within the What Women Want campaign, in patriarchal societies such as India and Pakistan, women are also used as a medium to convey what men want, due to quota systems and so on. Women heads of certain villages, but usually her husband, father or son, in reality run the show behind the back. Did you come across any such scenarios? And if so, how did you address them? Dr. Smita.
Thank you for that question. I think the person who asked the question has left, but nevertheless, that's an interesting question. And yes, I think we are still in transition and a lot needs to be done. We did face issues where the woman who was the head of the village assembly was just sitting, and there were some additional people who were men were taking lead on her behalf. So still I think we need to work a lot, and women are still not at the forefront, but they are physically there. But I do agree that many times men run the show. Having said that, there are cases where only women panchayats have formed and done great works. There are women leaders who have taken up issues of maternal health and women's issues such as violence against women and address them. So we see both scenarios. Few where women really are powerful and run the show, but we need to work a lot. Regarding the multi-sectoral nature of issues, I think in most of the countries, there are different departments, and many times departments don't talk to each other. So we as civil society organizations have to clean out the demands, and based on that, we have to approach the departments. So, writing letters like water is different, road is different. But then when we come at the local level, there is a convergence. It's challenging. Convergence of different ministries, convergence of power is challenging. But there are beginnings and processes are being done to have a common plan. For example, at the village level, at the Gram Panchayat level, the Gram Panchayats are supposed to be developing a Gram Panchayat development plan, which includes all the development issues which come under the Panchayat. So in that way, convergence takes place.
Great, thank you very much for that. Tara, please, you spoke of women being hesitant to participate because they felt nothing would happen. How do you re-engage the women who gave their demands to maintain trust and keep them being involved in pushing change? And if I can tag on the second question as well, how have you as a young woman engaged with older women within the movement? Gemma.
Thank you so much. Well, I would like to kick off from the point that, as you know, that my country is actually a religious country in terms of people are mostly influenced by the religious point of view. So I actually had a discussion, radical discussion, logical discussion with the older women, in fact, with the younger women as well. So yeah, I had a dialogue with them based on the historical context, based on what our religion has actually said about go and voice your opinion, ask for your rights, because unless and until you do not raise your voice for yourself, nobody gonna change these circumstances for you. So I actually had discussions and dialogues with the people, with the women particularly, to record their demands and their voices. And they were interested to voice out their opinion, although some were feared just because of the situations in the patriarchy society we are living in. But every woman has their own story and they really want to say something, but just need a platform and the opportunity.
Thank you very much. Naisea, do you have medical missions within your context? And how effective are you with engaging, maybe not just you personally, but the women's groups? How effectively do the communities engage with them? Are they helpful? And also, can you comment as well with engaging with women of different ages in your work?
Thank you for the question, but kindly could you repeat your question? I didn't get it right.
So the first one is engaging with medical missions, you know, the different specialists who come and work within the different villages and so on.
Okay, thank you.
Medical services, yeah.
As I said, as I was concluding my talk, we are as youth advocates, we are trying to be at the decision-making tables, because these are things that are only going to be influenced by the decision makers. So when we try to engage our leaders who actually can do something about it, that is our beginning point, trying to explain to them these problems that women are undergoing, and giving our ideas on the solutions to be given. And yes, we include the professional medics when we have conversations with them, with the county ministry of health. That is through our area members of the county assembly, because that is the lowest hierarchy of leadership that we can start from. I hope that's clear.
Yeah, yes, that's great. Thank you. Kim, would you like to comment as well, please, before I move into the next section?
Yeah, absolutely. Thank you, Dr. Pascal. So to the question around engaging older women, I did want to just highlight briefly that, again, looking at the broader What Women Want global campaign, about 8% of responses or so came from women that were 45 years of age or older. So again, it's a smaller segment because the vast majority of responses did come from women and girls of reproductive age. But we did actually engage older women. They shared their voice as well. And I'm trying to remember the oldest entry we got, but it was certainly, I think, even in the 90s. You will be able to actually filter for that information with this interactive dashboard, which we're really excited to share with you in just a moment. And I did also just want to express appreciation to the speakers who just went now for really painting such a rich, inspiring, compelling picture of just what it took to actually mobilize and reach women and girls and, you know, create that comfortable, safe space to share their thoughts and perspectives, which forms the basis of the dashboard itself, which you will see in just a moment. So again, thank you for the great questions, and I'll turn it back over to Pascal to introduce our next set of panelists.
Thank you very much, Kim. So the next section, this whole event really was about doing a launch of the wonderful data that has been collected, that has been put together and presented by these experts into a dashboard, and they will do a demonstration to show you just how wonderful the data are, but also how you can access it directly. The presentation will be done by Angel Katusia, a senior communications manager for White Ribbon Alliance in Kenya. Angel leads the design and execution of WRA's Kenya's communication strategy. She is highly driven and passionate communications professional who has vast interest in media, corporate communications, technology, and digital communications. She is a trained journalist and has in the past worked in leading local media houses in Kenya, where she won several UN-recognized awards for her work in maternal and newborn health. She's passionate about maternal health, youth, and women's empowerment. I'll also introduce the second presenter because they'll tag team this presentation. After Angel, we have Diana Copeland, who joined White Ribbon Alliance Global in 2016 and currently oversees White Ribbon Alliance's digital work, including the What Women Want interactive dashboard. Before coming to the White Ribbon Alliance, Diana worked for HBO's Real Time with Bill Maher as a researcher and as a member of Octopus Publishing Group's editorial team. Diana graduated from the University of Florida with a BA in English Literature and received her Master's in MA, Master of Arts, from University College London's Department of Information Studies. Angel and Diana, the mic is yours.
Thank you, Dr. Pascal. Please allow me to be off camera for now, and I will be on at the end for just people to see my voice. I'm just trying to make sure that the network is not going to be interrupted. So the dashboard that we're going to unveil today allows advocates and others to view the age and the country raw data to hear from real women and girls in their own words. The goal of the What Women Want campaign has always been to provide policymakers and advocates knowledge and insight into women's health demands in their own words. It is critical to have a pool of information that can be brought together and analyzed to discern patterns and make better decisions. Information is key to shaping new and existing advocacy projects. The dashboard can also be used by advocates and other stakeholders to improve decision-making and unearth valuable insights that would otherwise remain hidden. For example, how water is perceived by many is not how many directly defined it. Respect, which was topmost request by women globally, was defined in different phrases. Women said they wanted to be called by their names during clinic visits. Next slide. The dashboard will strategically assist donors and partners to support projects that align with women and girls' reproductive health needs. The information in the dashboard is raw from women and girls. The voices of women will ensure the project designers and implementers to design projects that have priorities of women and girls. The dashboard will also be a source of real voices of women and girls for media who can use these voices to amplify and create awareness and hold duty bearers accountable on matters affecting women and girls. Diana?
Next slide. So the goal of the What Women Want campaign has always been complete openness. The women and girls who participated wanted their voices to be heard, and their thoughts, opinions, and demands to be taken into account when policies were being made that would impact them directly. We thought a lot about the best way to share this information with the world. Releasing a Dropbox folder of responses on hundreds of Excel spreadsheets filled with 10,000 responses per page would have been one way, but would that have been useful or even usable? This dashboard was the only way that we could ensure that women's demands could be shared openly in a user-friendly way, while still protecting the individual respondent's privacy, so that anyone, anywhere could have access to this incredible repository of demands and use it to advocate for the kind of change women themselves are asking for. Next slide. So how did we do it? Smita, Tala, and Naise spoke earlier about the methodology of What Women Want and the immense in-person, people-powered mobilization needed for the campaign. I'll share a bit more about how we actually created the more technical side of the dashboard and how we categorized over 1 million answers to an open-ended question, which, believe me, was far from simple. Using the original campaign from India as a starting point, we refined the categories for a global frame. We initially had about 50 categories related to key areas identified for improved outcomes in maternal and reproductive health. But as was said earlier, women's and girls' answers took us well beyond that. Mobilizers sent suggestions for new categories as they heard from women. Other categories were created or consolidated based on volume and recommendations from technical and country experts. Then a core group of reproductive and maternal health and rights experts from White Ribbon Alliance refined the codes and hand-coded approximately 800,000, or 70% of the responses, often sitting together and discussing women's and girls' answers to ensure that everyone was categorizing responses in the same way. The remaining 30% or so of the 1.2 million responses were coded with the help of a data engineer who used Google's pre-trained BERT model and fine-tuned it as a text classifier, resulting in a micro-average precision recall score of 83.9%, which is very good. The dashboard itself is the result of this combination of people-powered hand coding and cutting-edge natural language processing technology and machine learning techniques. Taken all together, it means that over 1 million responses now feel tangible, as well as understandable and usable for advocacy purposes. It wasn't easy, and we are breaking new ground in many ways through this work. But we were able to push through when it felt impossible because it's important and because we promised women and girls that their voices would be heard. Next slide.
Marissa is going to share her screen now, and together with Diana, I will chat a bit about what this interactive dashboard is, how it is letting us all hear from women directly about issues that matter most to them, as well as to show how it can be used by the global community to advocate for concrete, sustainable policy change to help women and girls. The What Women Want interactive board allows for a duly unmatched level of access into women's demand by connecting women's voices with the almost infinite possibilities of digital analysis. We really see this as a one-of-a-kind resource. So when first accessing the What Women Want dashboard, this is the default view. There are buttons at the top of the dashboard that allow users to find out more about What Women Want campaign that was done in 2018 and results published in 2019. Watch an overview video and then activate a step-by-step tutorial that will walk you through the dashboard directly in your own time. The first stop in using the dashboard is to go to the section in the upper left that features the filter tools. Within this section, you will see two tabs. One allows you to drill down to get more specific information on response by country, category, age, and even keyword. Let's choose Kenya for now. The other tab allows you to compare two types of responses. This can be especially useful when attempting to contrast the responses from countries or to find similarities and differences between various age ranges. Let's choose Nigeria as the comparison. The upper right of the dashboard shows the number of women who responded, either in total or for the specific filters you have selected, and a histogram of their ages. Next slide, please.
Across the entire campaign, we were able to hear from women and girls from 114 countries, but most responses came from areas where White Ribbon Alliance works and where we were able to mobilize our extensive networks of supporters and advocates. The dashboard only highlights responses from countries that collected a significant amount of demands, about 10,000 or more.
Directly below the filter section is the breakdown of women's responses by topic box. As I mentioned earlier, over 1 million responses were coded and categorized by White Ribbon Alliance, either through extensive hand coding or through digital means, including natural language processing and machine learning techniques. Our code book separated responses into 39 categories to cover demands ranging from more and better health professionals, water, sanitation and hygiene, and respectful and dignified care. Our code book is available online to allow anyone the chance to see behind the scenes on how coding and categorizing decisions were made. This is just another way we attempted to be as open as possible with this work.
Immediately to the right of the category bar graph is a box that shows a sample of 1,000 responses. The responses reflect the categories you have filtered for, and the sample is changed every time the page is refreshed. And the great thing about this dashboard is that you don't need to take White Ribbon Alliance's word for any of it about what women were saying, because unlike other health questionnaires, which can turn women into maybe unknowable graphs or printouts on a PDF or some static diagram, this allows you to see each individual respondent's exact words. And as was mentioned before, throughout the campaign, it became abundantly clear from the women and girls responding that they wanted their voices to be heard. They wanted this campaign to matter. This demand for openness and the desire to be listened to is at the heart of the dashboard. And you can see that most clearly here in this section.
Below the breakdown of the category bar graph is a section that focuses on the top words and phrases mentioned within response demands. There are 3 views available: 1-word response, just like respect, 2-word phrases, or 3-word phrases. This allows for much fuller understanding of what was actually being asked for and how it was often phrased and grouped and paired with other demands. Let's say we wanted to take a deeper look into women's demands in Kenya for respectful and dignified care. As we look at the top single most phrase, rising to the top is doctor, respect, woman. This might give you a general idea of what women were asking for. But let's click into the 3-word phrase tab. Just look at the responses and you see abusive language, good communication skills, use polite language popping up. Women and girls are fed up being treated poorly at health facilities. They wanted to be spoken to with kindness and respect.
Now, you'll see on the map to the right that Kenya is highlighted right now. But let's see how the dashboard changes when we click on India and then Pakistan. And while that's loading, we're really starting to see the more interactive aspects of the dashboard. So we can head back up and explore the drill down features in a bit more depth together.
You've seen how when selecting a country, the dashboard will filter and show only responses from that country. But you can also select multiple countries to look at responses from an entire region. Let's add Uganda and Tanzania to the mix to see the dashboard at a regional level. This will be the East African region. This selection process can also be done with age ranges, response topics, and keywords. If we wanted to know how Kenyan women aged 20 to 30 demands related to water, sanitation, and hygiene, we can set those parameters with our filters. So you will see the dashboard is now filtered to only show responses that were tagged WASH in Kenya for women aged 20 to 30. We can drill down even further by searching within this category for the keyword water. We are now only seeing the times water was used within the WASH code. We can also exclude text. Let's try exclude drinking. Now the dashboard is only showing us water in context outside of drinking. You can see what women were requesting when it comes to water, having access to water for washing or bathing. I know cleanliness is a huge policy issue right now, particularly the ongoing COVID-19 pandemic. So another example we can try is looking into clean. We are going to clear the search term functions and replace water with clean to see how the dashboard changes. We can now exclude water to see responses that just had to do with basic cleanness and not the request for clean water.
And it's obvious to see that women and girls are tired of receiving care in dirty health facilities. When we're looking at their survey responses, we see that they urgently want cleanliness throughout the wider environment, ranging from labor rooms to hospital beds. Globally, this desire for cleanliness actually accounted for 65% of women's total WASH demands. And it's really quite telling. And it shows us that there's a huge problem with cleanliness globally. And I don't think that's a coincidence either, since environmental cleanliness is widely ignored and not prioritized on a policy level. But now, as an advocate for women and girls, you can use this dashboard to help make the case for the importance of investing in environmental cleanliness in health facilities, not just globally, but also nationally and at local levels too.
Exactly. For example, in Kenya, where we are implementing the Universal Health Coverage Project, we have empowered women and girls living with disability on their health rights to advocate for change at their local health facilities by having conversations with the facility management to ensure that the delivery of care meets the definition of quality, that is increased cleanness, clean linen, clean delivery beds, clean delivery rooms, privacy, disability-friendly facilities, just to mention but a few. Diana?
We know that this is a strategy that works too. Recently, the Niger state government in Nigeria made a policy commitment wherein focal primary healthcare facilities in the state will increase the number of clean, working, functional toilets from 3 to 6, so doubled. Why did this policy action happen? It's because WASH was the #1 What Women Want request from women and girls in that state. And leaders are listening to women and acting on their demands.
Who knows what else is possible and what other life-changing policy decisions will be made because women's voices were actually listened to and because their own words were actually seen. The dashboard allows everyone, everywhere, the chance to examine what Women Want campaigns' responses at a unique level of detail, a first for transparency in the nonprofit sector that we hope to see replicated in other organizations, campaigns, and initiatives. Thank you for your time, and we are so happy to take any questions and chat more about the dashboard.
Thank you very much, Angel. Thank you very much, Diana. That was absolutely awesome. I echo the compliments that are spilling through in the chat box for your work. I hope to see this, I hope to see more of it to extend the survey, and I certainly hope that you can push the efforts, and everybody who is on the call, push the efforts for funders, for governments and so on, to make sure that the where they put the priorities can actually, it is possible for this to actually be based on authentic data and the authentic voices of women. I will take a few questions and see how we go in terms of the discussion. So I have one here for both of you, or either one of you. Who are you hoping will use it? And what types of deep dive information have stakeholders asked for?
Angel, if you'd like to take that, or I can.
Pardon, please. Please repeat the question. Sorry for that.
Who are you hoping will use the dashboard, and what types of deep dive information have stakeholders asked for?
I believe the dashboard is going to be a critical tool to advocates who are implementing projects. Either they can shape their existing projects or new projects, because now they have the real voices of women and girls. I believe also funders and donors can now fund projects and say specifically the areas they want to target based on the requests that women and girls raised. I think it is also going to be a key tool for media. They always look for information to tell stories about women and girls, and this too is going to provide them with the raw voices of women and girls and the needs that they themselves are asking for. Diana, you can definitely add something, please.
Totally agree. The reason that we wanted it to be open was so that anyone could use it. You know, there's nothing behind the doors, basically. Everything is available. You don't need to have special access from White Ribbon Alliance to use this dashboard. It's truly open, allowing anyone who has an interest and a passion and a dedication to helping women and girls, they can use this dashboard.
And just to add something, I've had requests from advertising companies, from marketing companies, who are always working with brands that are always targeting women, and they've never had someone provide this information about what women want, particularly when it comes to their reproductive needs. And they were like, we can't wait to see what the dashboard has to offer, what the women said, because usually we have mostly lifestyle research done and just getting the social research done. So I think this is going to be not only for the health sector and for the media, but it's going to benefit a wider sector.
You actually raise an interesting question there, because effectively, and in this 21st century, data is currency. And there are certainly potential, there is the potential for commercializing both the kind of the infrastructure that you have, as well as the information. What would the implications for that be in the term, in the way that you have set up the architecture in terms of its security and so on? And should there be benefits derived from it? How does that go back? How do you feed that back to the people who provided the data? And I'm opening this up, including to Kim and other members of WRA, but also from participants as well, who may have had some experiences with this. Can you, I'm please opening up the conversation as well for you to contribute.
Thanks, Pascal. I'm happy to jump in first, and then I welcome any of my other colleagues to also share a response. I do want to kind of tie this back to the previous question around who is the dashboard intended for. And I do think first and foremost, we're intending this for those who work in the health and development space more broadly, in terms of actually looking at women and what they had to say, taking those demands and integrating it into your own existing agendas, whether it's from a programming standpoint, a financing standpoint, an advocacy standpoint. And also, you know, the dashboard is intended to share results back with the women and girls who also participated in the campaign, so that they can see sort of how their voice is even adding up to this big collective whole. The question though around commercializing the answers, I think, is interesting, and it's a bit thorny. I mean, we are putting this out to the world, and we recognize that, again, anyone has access to this. We put some safeguards in place in terms of sourcing informed consent from all participants, that they knew that, you know, what this campaign was about, and that their information would, you know, it would not be publicly identifiable to their name, but that their voices and their demands would be put out to the world. So I would just say that we're cognizant of that. It's a possibility, but again, our primary audiences are truly those who are doing the work, and that we really hope that you all, even on today's call, will listen and act accordingly. Angel, you might have some insight as well, just thinking about your comment too and connecting this with media. And I think you even mentioned sort of marketing in particular, if you have some thoughts on this question around commercialization of the answers.
I believe because we are opening up the data for everyone to be able to access the dashboard and to get the information. For us, what mattered most was the voices of women, and that then everybody would listen and act to make sure that the lives of women and girls get better because the women have voiced their responses. Yes, I know there are people who will ask, why are we just putting it there and people buy data? It's because of what we believe in, that the voices of women have been not heard for the longest time. And as a responsible organization, as a responsible cause that we are driving to make sure that the voices of women can reach to their highest duty bearers, I think that is the key number one for opening it up for everyone else. And I believe even when it comes to marketing and advertising, as much as they are doing that for commercializing, we believe the women then will be able to get products or services from those consumers or those brands that actually are what they wanted and not what the brand owners thought the women would want.
Great, thank you. I have, Diana, did you want to comment as well?
I think everything was covered. Thank you, though.
Okay, so I also have a question about how often these responses will be updated.
Sure, I can take that one. So, you know, this entire process has been a learning and growing experience. And, you know, as we've said before, we're really pushing the boundaries on technology and connecting with grassroots voices and movement. So we're hoping that as people share, you know, maybe some categories could be combined, some people would like things categorized differently. We'll be updating that as responses come in. We feel very good about the nature of this kind of give-take part of the campaign where everyone's input matters. We actually have a form on our site on the frequently asked questions where if you flag something for us, we'll take another look at it. We're really happy to do that. And as this becomes the groundwork of everything we do in the future, what women want and this methodology of asking an open-ended question, going back to women, we see so much potential in this dashboard to be continuously updated, continuously used as more information comes in, including future surveys possibility.
And just as an additional question to that, clearly you were able to, you know, get boots on the ground for a number of countries, but not all. What was the process, and is it possible to extend that to high-income countries as well? Because it would be really useful to engage with that, with a real diversity of voices. We talk about, particularly in the gender equality work, we talk about the gender dynamics and the power issues, and a lot of it focuses on, I guess, specifically with maternal and newborn health in low and middle income countries, but there are clearly issues with very marginalized populations in high income countries as well. So how do we make sure that we're inclusive of voices of women all around the world?
I can take the first stab at this conversation. So the campaign was open to anyone. We had an online form. Anyone in the entire world could take this survey. And we also got responses from 114 countries. So it's truly open. But we realized that the in-person mobilization was critical in having these kind of conversations. There were so many one-to-one conversations that led to the million responses. And because White Ribbon Alliance operates in the countries where the majority of responses came from, we were able to activate our networks. In the future, we would want everyone to participate in the same way, but we also realize that other partners should be able to take this methodology up. And we're really excited about the potentiality of that. More people doing this everywhere, all the time.
And Pascal, if you don't mind me coming in here too, I just wanted to comment that I think sometimes there's a feeling that digital solutions, are just going to be the next thing, and that's how we're going to reach everyone. And that's true to some extent, but what we found through What Women Want mobilization was that it wasn't alone going to actually amass the sheer volume of responses that we were striving to reach. I cannot underscore how important and valuable it was to pair digital collection alongside actual community mobilizers going door to door. And this is something that we are also thinking very strongly about as we embark on sort of a companion initiative to What Women Want, where later this summer, White Ribbon Alliance and the International Confederation of Midwives will be embarking on What Women Want Midwives Voices, where we will be asking similar questions actually to midwifery workforce in terms of what do midwives want and need to be their best self and to do their work most effectively. We are actually working with PRACAL with a project that we have with Merck funding to develop a digital tool that will allow us to capture and record those responses, potentially even do some of the coding and categorization in real time. But we are definitely not overlooking the absolute necessity to pair that with the in-person door-to-door effort that we found is just so instrumental to actually collecting these responses.
So you've opened up the door to the kind of next steps, and What Midwives Want is a very specific project. But do you have a media strategy to actually disseminate this further? What are the next steps with the dashboard?
If I take for media, yes, for us, media will be very key to make sure that they create awareness that this dashboard exists somewhere on our website. And we know that the media is going to probably talk to every other audience that we are trying to see. So yes, we have a strategy to engage both regional, national, and even digital media influencers to amplify the availability of this tool so that anybody who has been wondering, where do I get this information about what women want, then is going to be able to know where to get it. Yes, we use the media as part of the amplification process for the What Women Want. And yes, we are continuing to engage media to amplify that, yes, the results are here and you can see them in their raw form. And we believe we are going to go further with media engagements on just educating people and letting people know that they're here. We're also going to have some of our members do interviews and join Twitter conversations or digital conversations, just letting people know what is this beyond any other forum that would be available for us to talk about the dashboard.
Thank you. If I can suggest as well, perhaps a very targeted campaign to funders about this as well, because they are an important constituency to actually change the narrative as well, if they begin to respond to what women want rather than what they think women want or what they find easiest to fund. So that would be, I think, a really useful targeted strategy as well. I have a question here about whether women from Europe, US, Australia want something different from women from Asia and Africa. Is that sort of evidence clear yet, even though it is a limited number of countries?
I'd be happy to step in here. I would say that overwhelmingly, the responses that we received across the world dealt with respect and being treated respectfully in a health facility. Even though we had smaller numbers from other countries outside of our primary 8, respect was without a doubt overarching across everything. And it just shows the way that women are treated. Doesn't matter where you are. There's a lot more for us to go through to be treated the way that we deserve during pregnancy, childbirth, and every part of our lives.
Fantastic. I do not see any further questions. I think we probably have addressed most of them. If there aren't any further, can I hand back over to you now, Kim, please?
Sure, absolutely. Thank you so much, Dr. Pascal. And I think I put in the chat just now, just given the timing and the good discussion and presentations, we made a decision that we will not do the small breakout groups. But I do want to just take this occasion to ask a question to those of you who are still on the line. And I'm really interested just to hear from you all after listening to the presentation, seeing the dashboard, just what intersections you see between what women wants and larger gender equality agendas in your countries and your contexts, and how you might actually envision potentially using the dashboard after learning a bit more about it. This is an opportunity actually to even raise your hand, come off mute and say a few words if there are a few brave volunteers who would like to go, but would really just love to hear from a few of you all who have been listening and so actively participating. What is your reaction to all of this, and how do you potentially see yourself or your organization using the dashboard moving forward? I'll pop these questions into the chat box as well, just so you have a record of that. And I was thinking, just to kick it off briefly, Sandra, if you're still on the line from WRA Kenya, maybe you could just say a few words just to offer a different voice and lens from WRA in Kenya about how you might see using the dashboard in your countries, and just speaking to some of the intersectional issues that women and girls in Kenya are facing.
Hi, Kim. Hi, everyone. Thanks for giving me this spot to speak. Yeah, so just again, from an advocacy lens and programming lens, this is truly revolutionary for us, because even as we plan for our projects, and I can give an example right now where we are currently implementing a midwifery project, and it's having this dashboard is so important, because as we are responding to the requests, the midwifery related requests that came from the What Women Want campaign, there's an extra need to really go to that granular level of actually finding out what did they say when they say they wanted better supported midwives. What did that really mean? And having the dashboard is giving us that source of information. So even as we plan ahead, we not only have the top requests that came out, but then we are also allowed to, we have an opportunity to really go into the the categories and really interrogate what came out from the coding. So this is big for us. This is big in terms of our advocacy planning and programming as well. Thank you.
Great, thank you so much, Sandra. Any other volunteers who might like to tackle this question quickly, especially perhaps someone who is not necessarily affiliated with White Ribbon Alliance? Just give it a moment. Feel free to come off mute and share your thoughts.
Hello.
Yes, kindly go ahead.
Hi, this is Jen Elmaco. I'm joining you from Manila. Thank you so much for that presentation. I mean, while it was really being presented, a lot of things really went into my head. I'm a social scientist. I deal a lot, and I'm a researcher, but I'm also in women, peace, and security. So there's a lot of intersections that I see here. But what I'm excited about, that I really want to hopefully work together with you, is how we can use this to map out, security vulnerabilities, especially in communities that have like particular challenges when it comes to either disasters or because of conflict. So that is in the Philippines, for example, in the southern part, in Mindanao, that would be very helpful. Actually, in the work that I do, we did a lot of safety mapping with the Philippine Center for Islam and Democracy, and we are planning a talk in the next few days about this, and this would be very helpful. I do see, though, that you still don't have the Philippines in your map. So I hope that you consider also maybe expanding your work a bit more so that we would be included. Thank you so much.
Thank you, Jen, so much for those your thoughts there, and also just bringing up this really important issue in terms of linking with security and crisis, natural disasters. Just a couple of quick reactions there. The issue of security actually did rise up as part of the top 20 global results, and this was, as I understand, a bit more through the lens of, when women and girls are seeking healthcare services, not wanting to be assaulted, abused, feeling safe as they're actually walking or traveling to a facility. That issue was certainly popping up. It might be a slightly different lens than what you were just talking about now, but wanted to flag that it was coming out very strongly and very clearly, and would encourage you to kind of drill down on that within the dashboard itself. We did not have, as I understand, any mass mobilization effort in the Philippines in particular, but we're always looking for new partners who can help us, unite forces, mobilize. So we'd be happy to have that conversation with you after the fact, and also just happy to work with you as you prepare for events, coming up, and how you might be able to actually use the dashboard to inform that. Thanks.
Thank you very much. I'll be in touch, definitely. Thank you.
Wonderful, wonderful. We have time for another comment or reflection if there's another person who would like to just share a few thoughts as well. Great, thank you for sharing your details. Okay. All right, if there's no other comments or thoughts to that regard, I think we can actually just proceed with closing, and we can wrap up a little bit early and give you a little bit of time back in your day. Marissa, can you go to the next slide, please? Just have one more slide and then just a parting thought. So again, want to direct you all to the website link where you can learn more about the dashboard and connect with it directly. So please do visit www.whiteribbonalliance.org/dashboard. That will take you to a page that has comprehensive information and resources about the dashboard itself, and also will direct you to the exact precise URL to access the dashboard in and of itself. Next slide, Marissa, which is just a striking photo. I do just really want to thank all of the participants in this meeting today for coming along with us on this What Women Want journey. I think it was really evident through the presentations and the discussion today that What Women Want was just as much about building and unleashing women and girls' inherent power as it was about, mobilizing and raising those voices to actually change, spur changes in health systems and health policies and broader policies as well. And we really hope that, you all will feel inspired after this to not only advocate for whether it's your local government or other, power brokers to actually adopt women engagement mechanisms similar to What Women Want, or also to take what you've heard in terms of what women are demanding and really center that as part of your own efforts, and using the dashboard as a key tool to do that. I also want to extend a very, warm appreciation and note of gratitude to our fantastic speakers today who just really, again, shared their intimate experiences mobilizing for the campaign, and also building and launching this dashboard huge congratulations to my colleague Diana Copeland in particular, who's been working on this alongside one of our data consultants who is also on this call, Tom Wood. So thanks to both of you for making this long, simmering dream of ours an actual reality. I continue to just be blown away by the dashboard and what it can do and how it's truly revolutionary for our field. And then, thank you, Dr. Pascal, as well, for just being such an insightful, dynamic moderator. I know it's also very late where you are, so just really appreciate you giving your time and expertise to this discussion today. And then finally, last but not least, just really want to thank all the women and girls who participated in the campaign and were brave and had the courage to speak what they want and what they need, and are now working with us hand in hand to actually realize those demands. So with that, we will conclude our event. Marissa, you can go to the next slide. Just a title slide, but again, want to thank everyone for the robust discussion, the good questions, and our doors are open at White Ribbon Alliance. Please do not hesitate to reach out to us if you have any questions, if you're interested in a demonstration of the dashboard. We're here to do that. We're happy to do that. Please consider us a partner and an ally in your efforts. And with that, I think we'll adjourn 10 minutes early. So again, thank you everyone, wherever you are. Hope you have a good day, a good evening, a good night. That's it. So we'll adjourn now. Thanks all.
Thank you.
Thank you so much.
Thank you.
Goodbye.
Bye. Thank you.
Goodbye.
Bye-bye.
Goodbye.